So from the medication standpoint, there's two broad classes, one of which much more common. You've got anti-resorptive drugs. So we talked about bone resorption, which is kind of that process of pulling it out. Yes. So it slows down the rate that your body breaks down bone. In terms of commonly used meds, they use the term anabolic. That would be the other class. Is Forteo, that actually increases bone formation. But again, you're typically going to see, and it's not anabolic in that way we typically think of it, muscle building. It's just the most broad definition of just building up.
Okay.
So bisphosphonates are what you're typically going to, if you qualify to be prescribed here. So they work by, again, slowing the rate of bone loss. It's not like actively growing bone. It is decreasing the number of osteoclasts. Literally the number of cells, it's decreasing those. So there's less, there's a slower rate of bone loss. So this is your Fosamax or alendronate, which is a once a week pill, Boniva once a month. It's those types. And now there's also an once a year IV like Reclass. It's those types of medications. They're all in the bisphosphonate class.
So they're slowing down this natural body process. I assume there are consequences for that. These are all delicate systems here. What are the side effects of taking an anti-absorptive?
Yeah, anti-resorptive. Yeah,
resorptive.
So for the pills, nausea, heartburn, stomach pain. It really has a lot to do with just how the pills physically are affecting, as you're ingesting them. You also, especially with the IV ones, you're more likely to get some fever, headache, and muscle aches. Those can last up to 3 days.
Okay.
But it's definitely something that a lot of people are concerned about. Osteonecrosis of the jaw. So this is basically when your jaw doesn't heal after you've had a tooth pulled or something like that. The risk of that really goes up if you've been on the medication for longer than 4 years.
Okay.
And to tie in, typically, what's recommended is if your bone density is steady, you've been on this medication, your bone density has been steady for 5 years, obviously no fractures, then some doctors do essentially have you take a break for a period of time. But again, the osteonecrosis risk really hits at about 4 years, or of course, it's always going to link to the steroid use, the preds, the glucocorticoids, if you've been taking those chronically.
Sure.
And again, the ones to watch out for would be high dose inhaled steroids as well.
Okay.
All right. So yeah, that kind of covers the bisphosphonates. There's also a medication that's more commonly used nowadays. It's every 6 month injection, Prolia. It does also work to prevent the breakdown of bone, but it's not recommended in patients with low calcium levels, just via the mechanism that it works. So you want to make sure you're taking calcium and vitamin D with that one.
Okay.
And also joint and muscle pain, pretty common side effect with that. Evista. Or raloxifene. It's a selective, called a SERM, a selective estrogen receptor modulator. Basically a fancy way of saying that it has estrogen-like effects and can mimic estrogen. What's unique about it is on certain receptors, it's a estrogen agonist, and in other receptors, it's an estrogen blocker. So for example, in the bones, it functions like an agonist, so it will prevent bone resorption, but also at other receptors like in the breast or uterus, it can be used. It has anti-estrogen activity, so it can be used to reduce risk there.
Oh, okay.
These medications are not as effective for bones and osteoporosis and bone health as bisphosphonates are. And because of its kind of dual estrogen activity, also hot flashes, things like that, can be side effects of it, which a lot of women at this age are already dealing with. So, don't
necessarily want to make
between
that worse.
The effectiveness and that, it's not used nearly as much as the bisphosphonates, and rightfully so. In terms of the other class, the anabolic types, again, the bone building, not muscle building, the Forteo is the main one, an injectable drug. You can only use it for 2 years. It is if you have been diagnosed and consistently have low calcium, this is the preferred drug, essentially because it's a mimic of the parathyroid hormone, which can have effects on calcium levels, not just at the bone level, but at kidney and intestine level as well.
Okay.
So it's going to interplay on all those areas. And so or for whatever reason, maybe it's your diet, whatever the case may be, but you have low calcium, this is preferred for you over the other classes.
Okay.